Hi, my name is Sarah, and I've been interning at Eden House this summer here in New Orleans, and it's been a really incredible experience, so just wanted to share with you guys what I've learned. So if you've read my discussion post, you know that Eden House is a 2-year residential recovery program for adult female survivors of sex trafficking. So everyone that's in there stays for 2 years, and during that time they get medical care to deal with any past physical trauma from their life in sex work. They get psychiatric care, counseling, spiritual guidance, access to job and education training, and most of all, just a safe and supportive home that they can call their own for those 2 years. So far, Eden House has graduated 56 women in their time since 2011 when they opened, and they also do non-direct services through referrals to resources like counseling and other education programs like getting your GED. And so with that, they've touched over 100 women in the past 8 years since they've opened. So when I was coming into this, I thought that it was going to be very directly related to everything that I've learned in my public health classes. I've taken 2 classes specifically focused on women's issues, so Intro to Maternal and Child Health with Dr. Francois Grossman, and Reproductive and Obstetric Health also with Dr. Grossman. And so I thought I was going to be taking a lot of those, but what I didn't know is that a lot of this internship was going to be building skills, and more importantly, building relationships with these women. I read this book my freshman year at Tulane in my colloquium called Becoming Human by John Vanier, and it talked about the groups of people that we marginalize and dehumanize, and in that book it talked about homeless people, the elderly, and incarcerated people, and chronically disabled people. But I think people in sex work is another great example of people that are marginalized and shunned and dehumanized by larger society. And so going into this, of course, I wanted to treat these women with the same respect that I would offer to anybody, but there is a sort of separation that exists when you're thinking about all the experiences that they have and the kind of lives that they've led, and I wasn't really sure how to go about talking to them and being sensitive to their experiences, and trauma-informed care is a really big part of what Eden House and all of our partners do, and that's just what it sounds like. It's just care that is informed and influenced by how trauma affects people and how it's going to affect their experiences with providers, how it's going to affect their mental health, their physical health, their emotional health, and their overall well-being. And so, like I said, a big part of that is just building relationships with those women, because they've spent a lot of them several years or a majority of their life without strong support networks, without people they can trust, whether that's friends, family, because a lot of them were forced into sex work by those closest to them, and they don't have much experience with authority figures in a positive way, like a manager, a teacher, and they of course have negative experiences with law enforcement. A lot of these women have done prison time for drug charges and prostitution charges, and so coming into this home where someone is again in charge of them and in charge of what they do, and they have restricted mobility for about their first year, it can be very difficult for them. So one of the most important parts of the intern's job, besides writing grants and developing programs and taking the women to their appointments, is just being someone that they can be friends with and that they can feel comfortable with. So most of the women in the program are a little bit older. The ages range from 22 to 57, but there are a few younger women, and it's really important for them to have us there because they're able to actually kind of grow peer networks and be socialized with people their own age, people that are having the same experiences as them. The 2 younger women are going back to school and are close to graduating, so they have just kind of this opportunity to figure out what it's going to be like for them after they graduate. Some of the experiences I've had at Eden House so far have been directly related to my coursework. For example, I've done a little bit of grant writing for the director of Eden House, just because Eden House only gets a small portion of state funding, and that's relatively new funding, so the majority of our funding comes from private donors and grants from foundations. Right now I'm working on one for the Michelini Foundation, which is based here in Louisiana, and we focus a lot on organizations that cater to women's issues and children's issues, issues of sex work and human trafficking. So I've taken some of the knowledge that I've gained in those 2 public health classes I mentioned earlier to kind of build the research when I'm writing these grants, because of course they have to be very specifically catered. And then I've also done some other research for my boss, just trying to find some different literature so that on sex work and how trauma informs care and how trauma informs mental and physical health, so that we can find out the best resources for them, find out the best ways to deal with their experiences. And then I've also done, what I didn't expect coming into this was I'm actually working on a healthy living guidelines, and I've never taken any sort of nutrition class, and I try to eat healthy, I try to exercise, but it's not something I'm necessarily an expert on. So my research skills from my classes have come in handy there, and just program development, compiling resources, which is something I've done at a previous internship. But I think those things, while definitely valuable and will definitely help me build skills for later internships and later job opportunities in my professional life, above all, the relationships I have with these women have been the best part of the internship. Because, like I said, you come in and there's kind of a separation between you and the residents, because our lives are so drastically different. And being able to just come in and sit on the couch with them and talk to them about their classes that they're taking, or the jobs that they're looking for, or talking about their families or the friends that they've made since coming back to New Orleans, just helps to not only give them a space where they feel comfortable and a space where they can feel like a regular person again, but also helps me to see kind of the direct impact that my work and the other interns' work and Eden House as a whole, their work, how that's affecting them. And that's why I think it's so important. Of course, prevention is absolutely the number one thing we need to be working towards with public health, and Eden House does a good amount of that. I've talked in some previous discussion posts about the prevention workshops that they do at middle schools and high schools in the area, and in those they take a staff member and then a survivor leader who is someone that's graduated from the program, and they go in and they talk about what it looks like to be at risk for sex trafficking and sexual exploitation, and how to mitigate that risk, how to get yourself out of those kind of environments and experiences, and also just referring women that are already in sex work, especially forced sex work, to medical providers and mental health providers is really, really important to make sure that sex work, or coerced sex work I should say, starts to decline in New Orleans, because New Orleans is a port city and those are always hubs for sex trafficking, which is why Eden House's location is especially important. So that prevention is really important, but being able to work directly with these women and putting a face to the problem of sex trafficking and human trafficking, it makes the work so much more real. It makes everything I've read about in class, everything I've seen in the news, so much more real, and just kind of has re-inspired the passion that I have for violence prevention. I'm going to be starting the combined degree in the fall for maternal and child health to get my master's, and I know that I want to work in violence prevention. I've wanted to do that since I came to Tulane, and this experience has really just reaffirmed that that desire. And overall, I think that this experience has just been very rewarding for me, but I don't want to think about this experience as being directly about me, because it is a service learning internship and it's primarily about the community, and being able to be face-to-face with these women, seeing them 3 times a week, driving to them to their appointments, talking to them about their issues, has just been really rewarding. And knowing the different kinds of issues that they all come in with, the majority of these women, or all of these women I should say, have experienced sexual or physical abuse from the age of 7 on, started using drugs when they were 12 or 13, and started in sex work when they were in high school or in their early 20s. And a lot of their lives and a lot of their experiences are informed by what has happened to them, but it doesn't have to define who they are now. And that's a big part of what Eden House aims to do, is to help these women redefine their lives, redefine their identities, and be able to rejoin larger society and be able to put this past behind them, but also know that it makes them stronger. So that's what I've learned at my internship at Eden House. I would really recommend volunteering there if you have time, taking a tour, or just educating yourself on the issue of sex trafficking and seeing what you can do for violence prevention. Thank you so much for listening, and it's been a great class.